it shakes you up. Anybody who has been giving that sentence of cancer, it's scary. It really is scary.
It wasn't a shock. I mean, something was wrong. We knew something was wrong, and there was some weight loss, and so things go through your head. So, I wasn't expecting the worst, but I don't think I was expecting that.
My dad was diagnosed with colon cancer in 2006. We found out when I was pregnant that he was diagnosed with stage 4 cancer.
One night I came home and I was just passing blood in my urine, so it got me pretty worried. So sure enough, he went in and checked, and I had a tumor in the bladder, and he said he's going to remove it. He did, but it was spread, so he had to remove the complete bladder. And after that, I healed up like right away, and I was back on my feet, and I was able to do the same work I was doing before, and looking after things, and a little farm, chicken farm, and I'm still doing it. So
I went in to see my doctor July of 2012. I had a lot of back pain and some numbness in my right leg, and because, again, healthy, nothing wrong with me. I'd gone in for my physicals, nothing to indicate something was wrong. By December, I could barely get out of my car anymore. The pain was so intense, couldn't sleep. I happened to go to an after-hours clinic, and the doctor thought I might have something wrong with the discs, so sent me for a CAT scan, and that was maybe 2 days later. The next morning, my doctor was trying to find me, because what they found from this CAT scan was that the L5 was full of cancer, and that's when it started.
I've had an ultrasound in North Bay, I've had a CAT scan in North Bay, I've had an MRI in North Bay, and it's so important that we keep those types of diagnostic tools in North Bay.
If we could have found it earlier, chances are he probably wouldn't even be here today, so we would be even having this discussion.
We all have lives still. We all still have to work. My wife still has to work. My daughter has to go to school, and you don't want to be disruptive, but it was good. My wife took me a fair bit, but for the most part, I was able to go by myself. I went to work as much as I could, and just kept life as normal as possible. And I couldn't have done that if we were going to Sudbury.
You just feel better inside. You just feel better inside. And quote, now I can enjoy shoveling the driveway, get back into my minor hockey, which was a big part of my life, and just get back into the public and meet your friends again, and knowing that, you hope you're going to be all right, you want to be all right, and you feel all right, and life goes on.
Everything is clear. He sends me every 6 months for a checkup, and comes back clear. Everything is good, and I didn't have to go out of town or nothing.
This year in our community, over 1,200 people will be diagnosed with some type of cancer. They need to feel comfortable and confident that the health providers and the healthcare equipment that they have in their community will help them on this very, very long and often scary journey. With any kind of serious illness, we want the best that they can have, and quite frankly, this community deserves it.
It may surprise you that the government does not fund medical equipment, and that it's a responsibility of the hospital and our community together. And that's why our community is focused on raising $6 million to support the screening, diagnosis, and treatment of patients with cancer close to home.
As an ovarian cancer survivor, I do know that it's very hard to diagnose. And so if there are things that are coming out that can diagnose that disease, we need to make sure that we have it in North Bay, and that's why donations are so important. That's why support of the foundation is so important.
Whether it's donating time for their functions at the hospital, or being a volunteer or whatever, we all have a little something we can give.
One of the decisions after Dad passed away was making a decision as a family what the donations would be going to, and one of them was the hospital, particularly the cancer clinic, because of the fact that it was, we want to be able to instill for future generations the fact that we would like people in our community to be able to be closer at home to get the services that they require.
We want to keep the services in North Bay. We truly do. We want to have the best state-of-the-art equipment for imaging. We want to have that. You know, the fundraising efforts that they have are for equipment that we need in this hospital here. The healthcare system has its challenges. We all know that. So by donating to the foundation, we're helping to acquire the stuff that we need to keep those services here in North Bay. And that's huge, huge.
Please ensure that our community, your friends, your family, your loved ones have the best possible cancer care close to home. Please make a donation today.